Hi, my name is Will Courtney and welcome to Complete Connected Care, where we hope to provide you with ways to take control of your health with the help of the technology and convenience we offer right here in Greater Lowell. One of the biggest challenges to accessing healthcare is the waiting game. We've all done it. You have to wait for an appointment, sit in the waiting room to see the nurse or doctor, wait for tests, and wait for your test results. So at Circle Health, we're doing our part to reduce or eliminate the wait. Because we know if healthcare is easier to access, more people will use it. An important way we are doing that is by bringing care into the community in the form of Circle Health outpatient centers, like the one on Littleton Road in Westford. Each of our outpatient centers includes an urgent care, along with testing services and other offices, where doctors and nurses can treat the most non-life-threatening conditions 7 days a week with convenient hours and easy online scheduling. Any test results or doctor's notes go onto your shared electronic medical record and can be accessed by any of your other providers in the Circle Health network. That's convenience. Today we're going to talk to Dr. Roxanne Latimer, Medical Director of our Urgent Cares for Circle Health, to learn more about the best way to use our outpatient centers, some of the most common things she treats, as well as a specialty of hers, which is travel medicine. Stay tuned and we'll be back with Dr. Latimer. Welcome back to Complete Connected Care. I'm your host, Will Courtney, and I'm here with Dr. Roxanne Latimer. Thank you so much for coming.
My pleasure.
Today we're talking about urgent care and outpatient centers. Circle Health has outpatient centers now in Westford, in Billerica, Dracut, and now coming in February to Tewksbury. I think the idea today is to really try to let people know about all the services we offer, but just really about the convenience and the fact that we really have something special here in Greater Lowell, and if people are accessing it, it's going to do a lot of things for us. It's going to reduce the pressure on our emergency rooms. It's going to give you more convenient access to health. It's going to give you a chance to empower yourself to do what you need to do for your health without having to completely turn your day upside down, and that's going to lead to hopefully healthier people.
Absolutely.
So tell us a little bit about yourself.
Sure. I have been doing urgent care probably since the beginning of training in medicine. Initially, I trained to do primary care, but I have always worked in urgent care in addition to doing primary care. And about 8 years ago, decided to do urgent care full time. Now, urgent care very simply is something that needs to be seen by a doctor, but isn't necessarily life-threatening. Oftentimes, your primary care offices will offer some of that, but they also have a lot of appointments set for child checks or physical exams, and so sometimes it takes a little bit longer to have an urgent visit, and that's essentially why urgent cares have proliferated in the past few years. You're also seeing a situation where, busy families, lots of sports, lots of activities, and occasionally you can't quite make it to the doctor's office during doctor's hours, or, accidents, things like that happen on the weekends or off hours or in the evenings. Yeah. And so urgent care is a nice place to try to take care of those needs that, like I said, aren't necessarily life-threatening.
Well, and the lure of them is convenience, right?
Absolutely, absolutely.
One of the biggest complaints at a hospital is always wait times.
Absolutely.
In the emergency room, if you look at any hospital's sort of star ratings, I waited 5 hours in the emergency room, and I think people would be surprised to know that most people, I've seen statistics where literally the majority of people go to the emergency room could be treated by an urgent care if they chose to take that route.
Correct.
What are the conditions you're often seeing?
So it depends on the season, and that's one of the things that makes urgent care so interesting, at least from a doctor's standpoint. Right now we're in the transition between fall and winter. Flu season hasn't quite hit, but we're seeing a lot of colds that turn into pneumonias or sinus infections, ear infections, a lot of upper respiratory type complaints.
Cold season.
Cold season, exactly. We'll be coming close into flu season, which is usually just slightly more serious infections. In the springtime, we tend to see a lot of allergies and asthma exacerbations. Summer is a lot of orthopedic injuries. You're finally getting out of the house, the weather's nice, you're climbing trees, you're hiking, you're biking, and inevitably there are some accidents that can occur that require an evaluation by a physician. So each season brings its own theme, so to speak.
We often use the term non-emergent, basically meaning that non-life-threatening. Where does that line go? And I know there are sometimes instances where people shouldn't be going to urgent care, and sometimes they do, right?
Very true. So urgent care is not the place where we treat heart attacks or strokes, fractures where the limb is at risk because there's no circulation. Those kind of more serious conditions really need the ER. Sometimes it's subtle. Some people will come in with belly pain. They're hoping it's something simple like a urinary tract infection, but in fact it's probably early appendicitis or something a little more serious. And for those patients, we'll send them over to the emergency room for further evaluation. So sometimes it's a little hard to know. The real emergencies, people can't breathe, etc., bad head injuries, those need to go straight to the emergency room.
Right?
Exactly. But sometimes you'll come in feeling okay, have a few symptoms, and turns out it might be the beginning of something more serious, and we'll direct you to where you need to get that care.
Yeah, but even things like lacerations and things, as long as you're not severely bleeding, you can come and see you.
Yeah, we do stitching, we do gluing, we do all sorts of repairs. Occasionally if ligaments are involved and they need an actual operation, that's obviously going to go to the hospital.
And I think some people might believe that when you go to urgent care, well, where do my records go? What now? I have an X-ray, and obviously that's one of the benefits of these Circle Health centers. You can do a blood test, you can get an X-ray there.
Exactly.
But where does that patient that comes to see you, whether it's for the flu or a broken bone, where do they go from there?
Very good
the process
question.
doesn't stop.
Because we're connected with the primary care doctors in Circle Health as well as the specialists, we all share the same record or access to the same records. So it's nice. I'll see a patient maybe for an ankle sprain, but notice the blood pressure is a little high. We'll discuss it, and then I'll recommend that patient go back to their primary care doctor. The primary care doctor will receive my note and be able to see that patient was here for an ankle sprain, but the blood pressure was a little bit elevated, and that the patient's going to be reaching out to the primary care doctor to address that. I can also instant message the primary care doctor if there's something that needs immediate attention. So it's a nice extension, so to speak, of primary care. We don't do primary care and urgent care, but we do see those urgent visits, and it's as if the primary care doctor it was seen by one of their partners or coworkers.
Right. Well, we were talking a little bit about the fact that we have access to these great orthopedists in this area. And Circle Health has over 700 doctors. So if you're wondering if your doctor is in the network, it's a very good chance if they are in the greater Lowell area that they are. You can always check on our website at circle-health.org. But that kid who goes out and sprains his ankle on a skateboard or has maybe a more severe break that requires surgery, what are you able to do for somebody like that?
Really good example. Recently saw a boy over the weekend, I think it was a Sunday, with a pretty severe ankle fracture from roller skating, basically, and was able to contact the orthopedist while the patient was still at our center. The orthopedist reviewed the x-rays and said, yep, absolutely, splint him up, make sure he doesn't bear weight on it. We'll make an appointment for him Monday morning, and he was in the OR on Tuesday. Wow. So really, and the benefit to the patient is the visit at urgent care is generally under an hour, and he still got quick resolution to the injury that he had. So that does tend to happen a lot, especially with orthopedic injuries. Probably about a third of our visits are orthopedic injuries, and we're able to integrate with orthopedics and get the patients in to be seen and get their condition resolved.
And the idea that you're able to share that information, that he sees the same x-ray, that he sees your notes, that continuity of care is just unfortunately not everywhere has that.
Exactly.
And sometimes those gaps can mean that person doesn't have the full picture.
Exactly. Not just orthopedics, though. At the Circle Health Urgent Cares, we have the ability to consult any specialist within Lowell General and the Circle Health system. So for instance, if I have a patient who has a neurologic condition that may or may not need further evaluation in the ER, I can consult a neurologist and have a discussion with that neurologist about the patient's symptoms and whether they feel this is something that needs to be addressed immediately or within 2 to 3 days. Oftentimes what will happen if we both decide based on the patient's presentation that they need to go to the ER, to the hospital for further care, the consultant will say, well, that's great, just tell the ER doctor that I've already spoken with you about this patient. I'll run into the ER when they come in and drop a note and see the patient in person. So it's almost like an extension of the care, both with, simple things like rashes where your primary care doctor is aware that we started a prescription to treat a condition, or something more serious that needs to be further evaluated in the emergency room and perhaps have a procedure done or some kind of testing done.
Right. And one of the great things about Circle Health is also our partnership through WellForce. So we now also have access to specialists even at Tufts Medical Center. So really any kind of care you need is available here, and often those specialists are coming down to our facilities. We were discussing even at the Westford Outpatient Center, there is a pediatric specialist office that's handling certain cases, and whether it's at our surgery centers, at the hospital, these folks are coming to us. This is not a, hey, we can send you to Boston. This is a, hey, we can keep you here for most conditions that happen. So, so talking a little bit about the flu, because it is that time of year.
Definitely starting, yes.
Are you able to get a flu shot at a Circle Health outpatient center?
Yes, absolutely. And again, part of your comment about urgent care being convenient, we all know we're busy. 2 working parents, like I said, kids, sports, activities. It's not always easy to haul the whole family in for a flu shot at a designated time. But if you happen to be in the urgent care for some other reason and you're not currently having a fever, it's perfectly safe to give you your flu shot then. So
Can you take walk-ins for that? If somebody says, I just saw this, I need to get my flu shot, it's down the street.
Yeah. And, our goal is to get as many people immunized as possible. That usually makes the flu season less dangerous for the whole population and protects you from missed work and illness that can get more severe. So making it convenient, but also making it available to you is our goal.
Yeah, increased access. When somebody is wondering, there's that person who's deciding whether to go to the emergency room or to an urgent care, but there's also that person who's deciding whether they should go to the doctor at all. How can somebody tell if they've got the flu versus a cold?
Oh, that's a very good question. I would say the vast, vast majority of the time, flu is going to give you a fever. Adults don't really get fevers that often. Kids get them all the time with any simple cold. And more serious infections as well, of course, but adults rarely get them. So if you're feeling pretty sick and you've got a fever, there's a possibility that it is flu. Generally, flu is going to be, and when I say flu, I mean influenza, not a stomach bug, which we sometimes refer to as stomach flu. But influenza is unique because it's essentially the worst cold of the season. It's a viral illness like all colds are, but it's the most aggressive. So what is the biggest issue with influenza is the consequences of getting it. For instance, if someone has asthma, they often have more respiratory complications from having influenza than someone who doesn't. If someone's very young or someone's very elderly or they have other medical conditions, influenza can be a very serious infection. And so that's why we push the flu shot to give protection to the individual, but also prevent the population as a whole from spreading it around each other. And flu shots aren't perfect. Every season's a bit of a gamble to see if the flu shot that was produced will match the strains that morph throughout the flu season. But even if they're not perfectly matched, you get some protection, and that's why it's worth getting the flu shot.
When we say some protection, can it alleviate, can you...
Severity.
Well, I didn't get it as bad because I had a shot.
Exactly right.
Okay.
Exactly right.
And the idea that you get sick from the shot is a myth.
It is a myth. The shot itself is a piece of the flu protein. So it can't actually give you the flu infection. Now, some people's immune systems, as it's ramping up protection against the flu, so think of it as soldiers.
Right.
You get a shot, you start producing a bunch of soldiers that know how to fight that infection. In ramping up those soldiers, sometimes you can get a fever or feel achy, but it's not giving you the actual influenza infection.
And so over time, you're going to get a little bit stronger. Your protection is going to get stronger.
Exactly.
But again, you still might get the flu. But
that is true.
You've got a better chance. You've got a better chance of not spreading it to other people.
Correct.
Don't do it for yourself. Do it for somebody else, because flu spreads through what, water droplets and
respiratory droplets, so much like colds do.
Yeah.
Sneezing on someone's, next to someone, coughing next to someone, wiping your nose, that kind of thing. Just like the common cold spreads. And it spreads pretty quickly, especially, in the winter months. We're in close quarters, it's cold outside, we're at the supermarket, we're on buses, we're on trains and subways and in meetings together.
Right.
So it's pretty easy to spread. And you bring up a good point. If your household has someone who's elderly or someone who has asthma or someone who's very young.
Or newborn, right? Yeah.
Newborn, exactly. Getting a flu shot will help you prevent you from getting it and giving it to the more vulnerable population.
Mm-hmm. Great. So get your flu shot, everyone. And if you're not sure, go down to Littleton Road and they'll take care of you.
Absolutely.
You'll be in and out, and it doesn't hurt. I had mine. Actually, in Circle Health, I just saw a stat, at least at Lowell General Hospital, we had a 99.3% rate of vaccination of 3,600 employees, which
that's fantastic.
Is great. So you're safe at Lowell General, at least from the employees. So. Another thing I wanted to talk a little bit about that I think people might find interesting is travel medicine, and I know that's an interest of yours. How did you grow into that interest?
Sort of, by mistake in some ways. When I was a primary care doctor, I happened to have a patient population that was very active in world travel. We're near Boston, which is a pretty global city as well, a lot of international companies around. So people around this area tend to travel overseas, whether they're originally from here or perhaps from another country, and they go back to visit family and friends. We have a lot of students here who do overseas travel. So there's a big need actually to obtain some consultation regarding travel.
And maybe tell people what travel medicine really is.
Yeah, travel medicine is really a way to evaluate where you're going, anywhere in the world, and have the travel consultant come up with the latest recommendations from the CDC on what can protect you. So very simply, in the United States, we're very blessed. We have protection against mosquitoes that carry things like yellow fever, although we didn't always. Interestingly enough, a lot of the types of infections that we see in other countries used to be present in the U.S., and waterworks projects, elimination of standing water has really improved our environment, so we don't get these exotic diseases as often. We also are very blessed in that our food supply is pretty safe and infection-free. You always hear, the salmonella outbreak here or the romaine lettuce outbreak there. So it's not perfect, certainly, but it's a lot more rare in the U.S. than it is in other countries. So as you're considering going to other countries, there's considerations to take. I would say the main consideration is really foodborne illness. Pretty much everywhere outside of the United States and Europe, we recommend protection against some common foodborne illness. One being hepatitis A. Most people get immunized against hepatitis B. That's part of your childhood immunizations. But hepatitis A is actually from the food supply, and you can get pretty sick with that. And another one is typhoid. Mm-hmm. Typhoid is very prevalent outside of the United States and Europe. And so those are two common foodborne illnesses that you want to protect yourself against, because it doesn't matter even if you're in, big cities and international hotels, it's still a possibility.
These are vaccinations you can get, or
Correct.
things you just need to be careful about as well?
Both.
Yeah.
If you're an adventurous eater, then I would say be very careful. But there are vaccinations that can protect you against those infections.
Okay.
And then another thing that we offer with travel consultation is really some safety guidelines for preventing other foodborne illnesses. Again, in the U.S., our food supply is pretty clean. And overseas, though they have their measures, or sometimes in smaller towns or rural areas, the Amazon, et cetera, they don't have as many resources to monitor the food supply. And so what might not get someone native to that area sick because they've had a low level of exposure their whole life will get you really sick.
Right.
So there's a phenomenon called traveler's diarrhea, maybe more commonly known for those who have visited Mexico in the past as Montezuma's revenge. Basically, that's an infection that you get from bacteria that's in the food. And so with travel consultation, we'll often prescribe a medication that you will take with you if you need it. If you experience, severe vomiting and diarrhea overseas, generally it's due to one of those bacterial infections, and you have the treatment available to you.
So if someone's planning a trip, maybe they're going abroad, maybe they're for school, maybe they're taking a trip to some interesting place, how would they access your expertise? They make an appointment at the urgent care?
Yep. So the way we do it now is you go online to the Circle Health Urgent Care site. There's a travel medicine portion of that site, and you can basically submit a health questionnaire that asks where you're going, for how long, what countries you're stopping over in, what some of your relevant health history is and vaccination history, and you can actually make an appointment through that online portal to be evaluated.
Are there certain parts of the world that you say, well, if you're going to Canada, maybe you don't need to worry so much about it. If you're going to place X, that maybe you need to think more about this?
Yeah. So most places outside of the continental U.S. and Europe, we do recommend vaccines that typically people don't get through their routine vaccination. So, for instance, South America is a place where there's a lot of yellow fever. There was a recent outbreak in yellow fever in Brazil that actually came in from the Amazon closer towards Sao Paulo, which is one of their major cities. And so at this point, unfortunately, in the U.S., there's a shortage of yellow fever, although we will be hopefully getting it during 2019, so we can offer
shortage of vaccines,
the vaccine. But in general, South America has the yellow fever concern. Some parts of Africa have a yellow fever concern. Some parts of Africa have polio concerns as well as meningitis. And so we can update those vaccines if you happen to be going to those portions of the world that where these infections are still prevalent.
What about some of the more commonly placed places that people might go, whether it be maybe the Bahamas or the islands or Mexico? Those are all such popular destinations in the winter.
They are, yeah. And again, the foodborne illness is really the concern there. So vaccination against typhoid, vaccination against hepatitis A, and perhaps treatment for traveler's diarrhea in case you get it is important.
And as we were talking about with the flu, it takes a little time for these things to build up. You don't want to do it the day before you leave, right?
Exactly. We generally recommend that you seek the consultation about 1 month before travel. Technically, most of these vaccines are effective within 2 weeks, but you want to have a little bit of a buffer so that you're fully immune by the time that you travel. And then there's some unique places, places in Asia where some vaccines like Japanese encephalitis may be recommended. Those actually take a full 2 months to be fully immunized. So you want to make sure to plan ahead if you have that opportunity.
The world's a kind of a complicated place.
It's
a big
is.
Place. How do you keep up on what's going on where?
Very good question. CDC basically updates that information on a daily basis. And so our providers have access to that updated information, and we review it right before you come in for your travel consultation.
Now, are you seeing, now that we've put some of this out there about your travel medicine work, have you been seeing people come through
Absolutely.
taking an interest?
Absolutely. A lot of students who do a semester abroad, a lot of international travelers for work.
Yeah.
You have a plant in India, and so you have to go there for a week to look at production, or China. And then there's the adventures. Those are the ones I enjoy a lot. For instance, people who are climbing Machu Picchu, where the altitude is super high, and so we give some recommendations regarding high altitude medication or treatment for that disease. Even sometimes, some of the higher skiing elevations may warrant treatment or prevention for that.
What can you do for those folks?
There's medications that help prevent fluid building up in the lungs, and that's basically the biggest complication with very high altitude places. Generally, humans aren't really feeling it until they hit about 10,000 feet.
Right. Okay.
But then there's some recommendations we can give too. You don't want to get dehydrated. You don't want to drink a lot of alcohol, which dehydrates you fully.
Yeah.
You want to give yourself some time to acclimate before you do vigorous activity, things like that.
So you're seeing these folks before. How often do you see the folks on the other side coming back? And
Rarely,
yeah, good,
if they've come for
Yeah,
consultation.
they've done the right thing.
But occasionally we see people that either didn't have a travel consultation before, or weren't aware of it, or are from those countries and they come to the United States and have an illness developing like malaria. Malaria is still pretty common outside of the U.S. And again, I always find it interesting that we used to have malaria as well, but
Right.
luckily not so much anymore.
Polio, things like that.
Exactly. Polio was thought to be eradicated a few years back, and there's pockets of it. There was an outbreak in China. There was an outbreak in Africa, and now actually just recently the Middle East had an outbreak of it. And so, some travelers to the Middle East actually aren't allowed to leave the Middle East until they've been vaccinated as an adult.
Mm-hmm.
And that gets tricky because they have the old version of polio, not the new version of polio. You and I probably had the liquid polio vaccine as opposed to the shot. The shot's much more common, and they don't have that there. So we like you to get immunized before you go to the Middle East so that you don't have to deal with perhaps being detained
So
there.
that wouldn't be fun.
Yeah.
So if you think, oh, well, everybody gets a polio vaccine in this country, right?
They do.
You should probably still double check.
Yeah, really what we're talking about is a one-time adult booster.
Okay.
Just in case. So, there's the possibility that your polio immunization, which, almost 100% of the U.S. has it because they can't really go to school without it.
Right.
But it may wane over time. And so if you're going to a place where there's a particular outbreak, they recommend a one-time lifetime adult booster of it, and that should protect you against any exposure you may have over there.
Sure.
One other vaccination that I wanted to mention, it's more rare for travelers, but rabies vaccination. There's a lot of interesting places in Asia, islands you can visit with unique animals, safaris in Africa where you may interact with the animals a bit. And in rare instances, even a rabies vaccination series is recommended if you plan to be working with the animals.
Well, there's a lot of countries with stray animals as well, right?
Correct.
So.
And so sometimes rabies would be considered for, say, a child who may or may not know not to, approach a stray animal.
Right.
But in general, if you're directly working with the animals, there's some, safari trips where you get to interact with the wild monkeys or whatever. And if you get bit, they're going to detain you until you've had the whole series, which can take several weeks. So you want to prep for that.
Great. Well, we've got a couple minutes left, and what I wanted to do quickly was sort of just walk people through. If they've watched this, they say, well, geez, this is a service I could take advantage of, whether it be I'm not feeling well or I want to come talk to you. And again, we should remind people that if you want to check what vaccines you have and things, go to your PCP.
Absolutely.
You're not a PCP.
Correct.
You provide many services, but sort of on demand. But certainly check with your PCP, and if you need to get some expert advice, come see Dr. Latimer. And so I wanted to tell people a little bit about how to actually access this, and it's very easy, it's very convenient. Part of what Circle Health tries to do is leverage technology to make all of this easier. So you can go online, there's online appointments, you can literally look at the list of appointments, right? And so let's say I go on and I want to go to Westford and I click on a 1 p.m. appointment because I've got a fever. And I show up, how long, I know you can never completely predict, but how long would I wait to see somebody probably?
Very good question. So I'm going to bring up 2 points about that. One is, on average, our patients are in and out of the center within an hour. Obviously, if further testing is required, it may take a little longer. If it's a straightforward visit, it may take less time. But that's, on average, the visits are under an hour. In terms of the online appointment, how that works is it speeds up your registration time, basically. And so you're able to come into the center quicker.
Yep.
Now, obviously, there's peak times that we're more busy and non-peak times, and that can change on an hourly basis to some degree. We do have wait times of all our urgent care centers on our website, and what that wait time means, because you got to compare apples to apples, right? What that wait time means specifically is from the time you enter the center to the time that the nursing staff are completely done with taking your vital signs, doing any preliminary testing that you might need. That is the wait time that's posted. And you can actually compare Westford to Billerica to Dracut, so that if you happen to be nearer one or the other, you can take a peek at that and based on those wait times, decide which site you go to.
Might be best for you.
Exactly.
And again, Tewksbury in February as well.
Exactly.
Dr. Letterman, we're out of time. I knew we'd be able to fill up a half an hour pretty quickly, and so thank you so much for coming. And if there's a new topic to talk about coming up, we'll get you back. But
Perfect.
Thank you so much for taking the time. Thank you all for watching Complete Connected Care. I'm Will Courtney, and we'll see you the next time.